All right, here we have the humerus. When we talk about terms to know bone structures, the proximal rounded end of bone is called the head, and distally, the rounded end of bones are called condyles, but these two condyles have specific names. Small rounded structures in bones are either called tubercles or trochanters or tuberosity based on their size. So let's start at the proximal end. On the proximal end of the humerus, you have your head, and when you look closely to the head, you have some small rounded projections. One is really large and one is really small. The really large one is called the greater tubercle. You can see it on the anterior and the posterior aspect, the greater tubercle, and then the one in front is the lesser tubercle. When you say sulcus, it means long, shallow indentation, and since this one is between the lesser and greater tubercle, it's called the intertubercular sulcus. It's where this pen tool is going in between. The rounded projection that's rough in nature in the middle of the humerus is called the deltoid tuberosity, and when you follow it distally, you have a couple of condyles. The condyle that looks round like a head is called the capitulum. The one next to it is called the trochlea. And then since these are condyles, you go above it and you call these epicondyles. Now the way you know medial from lateral is you always follow the head distally, and whatever side the head is medial. So you have the medial epicondyle because it's on the side of the head, and the lateral epicondyle. Now the word for in front is coronal or coronoid. So the fossa that you see on the front is called the coronoid fossa, and the back of the elbow is known as the olecranon. So this is known as the olecranon fossa.